Hi, everyone. I'd like to do a shout out to our sponsor, Bako Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Bako Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of our clients, Bako Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the profession. Bako Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Bako Diagnostics services, get started today by sending an email to corporaterelations@bakodx.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff, how you doing?
I'm doing fabulous. I appreciate you covering for me today in the studio. I had a little car issue this morning.
It always happens when you don't need it.
Yeah, I was thinking about that. Is there ever a good time to have a car issue? Probably not.
Yeah, no, I love coming down. I get to get the full get up. So
Sounds great. Well,
I'm really excited about today.
I'm super excited. We've got a great episode in store for everybody. I would like to introduce to Dean's Chat from the Samuel Merritt University College of Podiatric Medicine, Miko Fogarty. Miko, welcome back to Dean's Chat.
Thank you so much for having me back. It's such an honor, and I'm so happy and so excited for today's episode as well.
Well, I was sharing with Joe earlier that you are the first non-Arizona college student to be on Dean's Chat twice. So we're super excited to have you back.
Thank you. Thank you so much for having me back.
Oh, you're welcome. Joe, I'll turn it over to you.
Yeah, and Miko, I appreciate you when I emailed you to say, hey, would you be interested to come on? Because I think your story is one that resonates with a lot of different students. And it's really quite exceptional. So having the opportunity to kind of talk about that and get your take and your experiences as a fourth-year podiatric medical student, as Dr. Jensen said, currently at Samuel Merritt University College of Podiatric Medicine. But prior to that, Miko was born in London, and she is an award-winning professional ballet dancer. Currently, she's a student for podiatric medicine, but she still continues to teach both internationally and locally with advanced and I guess all levels of ballet at this stage of your career. She was one of 6 ballet dancers featured in a critically acclaimed documentary, First Position, a ballet documentary. And she went on to do her training. Sorry. Yep. You joined the Birmingham Royal Ballet, and you were the youngest artist in 2015, which I think, again, I'd love to get some of your take on what that was like to be a young performer in something like a prestigious position, such as the Birmingham Royal Ballet. You've received worldwide recognition as well as multiple medals. A few that I want to highlight are a gold medal at the Moscow International Ballet Competition, which, I mean, that's exceptional. We talk a lot about striving for excellence in the field of podiatric medicine, and I'd love to get some of your take on your ballet career, as you're clearly an exceptional ballet dancer, ballerina. So welcome to Dean's Chat, and if you don't mind telling us a little bit about how you got started with ballet when you were a child.
Sure. Thank you so much, Dr. Richie. It's so nice to see you again. So I started ballet when I was 4 years old. I remember I watched a performance here in Berkeley, California, and I just really loved seeing all the beautiful dancers on stage. And at that time, I was really interested in the arts, and I did some classical music and tennis and ballet, and I just really always enjoyed ballet class. So I continued on, started competing when I was about 9 years old, and started doing like more serious ballet competitions, like international ballet competitions when I was 15. And yeah, I trained very, very hard. I actually started homeschooling to be able to accommodate my training schedule, because it's like training for the Olympics. You really
Yeah.
your whole life to this art form. And it was definitely an intense part of my life, but something I definitely don't regret and something I learned a lot from, especially the work ethic and the discipline that it takes to be at that level, and something I'm proud of looking back as well. And yeah, I got injured in the process a couple times, saw podiatric physicians at that time, which is what introduced me to podiatry, which I can go into depth a little bit more from. And then, yeah, joined a ballet company in the UK, toured around the United Kingdom doing that. But at the same time, figuring out that performing was not giving me like the joy that I would hope it gave me, as well as some of like the body image issues I was going through at the time, which was very difficult. And that's when I decided that I wanted to start kind of exploring other parts of my life and some other things I was interested in, which brought me to healthcare. And then looking back on my experiences of getting injured and working with podiatrists, um, started getting me in the direction of podiatry, which is where I am at now.
That's fantastic. And I know through some of the things with dance, you've had the opportunity to do some TED Talks with Berkeley. Can you
Yeah.
talk a little bit about that as well? Because not only the TED Talk, that was 2019,
Yeah.
but also Imagine Talks
Mhm.
was in 2020. So can
Yeah.
you talk a little bit about some of your experiences that led to other opportunities?
Oh yeah. Oh, I've been so grateful for those opportunities. Basically, it started because I did an interview with the National Public Radio back in, I think it was 2018 or 2019, where they kind of delved into my story as well. And I think someone from uh, the TEDx Berkeley heard that on the radio. And since I was going to UC Berkeley at the time, go Bears, they invited me to speak about my story, and I decided to talk about how it's okay in your life to change careers, to explore something that might be uncomfortable at the time, but to follow your passions. And it was, it was my first time speaking on stage, and it was in their Zellerbach Hall at UC Berkeley, which is like a 2,000 person auditorium. So I've danced on stage hundreds of times, but I've never spoken on stage, which is a little different. So I, took a month or two to prepare myself and know what I was talking about. And yeah, I did it. I was really happy with how it went. And thankfully it was before COVID, so we were able to do it live. And then, yeah, the following year, I did a similar talk at Imagine Talks organized by Dr. Francis Kong. And that was also such a great experience to be able to speak publicly was something that I learned to do during that time. And yeah, what a great experience. I loved it for sure.
Now, were you in your first year of podiatric medical school when you did the Imagine Talks? Because
Um, I
trying to
think it was
remember.
in my gap year. I think I started podiatry school in 2021. So
Okay.
it must have been in my gap year, I think. Yeah.
Yeah. So you had gone through your ballet training. How did
Yeah.
you get introduced to podiatry? You said you had some injuries. What was
Yeah.
it that sparked the interest to go down the career path of podiatry for you?
Yeah, so I guess when I was 15, I was in Japan. I broke my second metatarsal, sprained my Liz Frank ligament, and came back to the US the next day, went to Kaiser Walnut Creek to be seen by a podiatrist. And, during that time, it was such a difficult time for me because it was the first time I had to take multiple months off from ballet, which is the first time I'd done that ever since I was 4 years old. And it really helped me step away from the like all-consuming ballet bubble I was in, and you know see life outside of ballet. And that was not the time that I chose to become a podiatric physician, but planted the seed in my head. And then when I was deciding to leave ballet was when I was, really inspired to go into healthcare just from how the the doctors that treated me like helped me get back to the stage. I was just so grateful um, to be able to dance again after that. So I wanted to be able to do that for other people. And actually, one of my best friends that I met in community college, who was with, I think, on this talk last time with me, Dr. Riza Chiri Zarzosa. She's now in New
Yeah.
York, but she's one of my best friends. And she went to podiatry school, and she was telling me all about, the great things you can do as a podiatric physician, from surgery clinic, all the types of different patients you can see. And I was like, wait, that would make such perfect sense for me to go into that field. And I did a little bit more research, started shadowing during college, and I'm so grateful for this field and have been loving it ever since. So, yeah, that's kind of what got me into podiatry.
Yeah. And it's so fun, right? How we have these different opportunities. You meet different people and you learn more from them. And you
Yeah,
and Riza have stayed friends and stayed in contact
yeah,
with each other.
yeah,
Can you talk a little bit? So, you had started to make that transition,
yeah.
and you did something similar to me that you went to community college first, and you
Yes,
got your associate's degree in chemistry and biology, and then you transferred into UC Berkeley. Can you
yeah.
talk about why maybe you chose that path?
Yeah, absolutely. I am such a huge proponent for community college. I actually had the best experience. So, as I kind of mentioned earlier, I was homeschooled. I did online school, basically like Canvas, like how people did it during Zoom, I mean, during COVID, where from the age of 12 to 18, all of my school was online. And so I did not feel prepared at all to go to regular university. I never really even expected that I was going to go to college, to be honest, because most dancers don't. Some do, but that was not something I was expecting in my life. So I didn't even know where to start. But the community colleges we have in California have such a great transfer rate to these amazing state schools. And yeah, I just thought that it would be a smoother transition going through that process for me. And I'm so glad I did. I had such amazing professors at my community colleges because they weren't necessarily there for research like a lot of the UC professors are there. They were there to teach,
Mhm.
and they were just such amazing professors that helped me feel comfortable in this foreign environment when I started, and kind of helped me grow my love for learning again. And yeah, I had no regrets going into community college. I decided to transfer to a UC. I really wanted to go to UC Berkeley just because my dad went there. And that's like the reason we moved to California from England. So that was kind of my top like school at the time, and I'm grateful that I was able to go. But yeah, I only have great things to say about community college. I really loved my experience for sure.
Yeah. Jeff, what are your thoughts?
A few thoughts. I also went to community college because I couldn't get into general chemistry at San Diego State. All of the sections were full. So
Oh
when
no.
I went to Mesa College in San Diego, I was taught by phenomenal docs.
Yeah.
One was my lab teacher was a PhD from Dartmouth that was raising her family, and she was just helping out. And
Yeah.
I had a phenomenal education. So I agree with that. Back to the task at hand, though, you said something earlier, Miko, that I wanted to highlight. You called ballet an art form, right?
Yes.
Um, and I'm not well versed in ballet. But so if I could ask you just a simple question, if somebody came up to you and said, Miko, I love how you danced and you're so beautiful, and what is ballet? I mean, how would you define ballet? Is that a fair question?
Yeah,
Yeah.
that's a great question.
I would define it as a performing art that takes a lot of athleticism, and it's where people express themselves on stage through dance. And oftentimes it's like some of the most beautiful things that you can see on stage. So simply that's how I would put it, a performing art.
Very good. And then the second question, I don't mean to derail the discussion here, but Mika, it took so much both mental discipline and physical discipline to become at the top of the ballet pyramid, if you will. How did that translate when you went to podiatry school, when you all of a sudden were in a class with lots of smart people? It was very competitive. You needed that same discipline. How did that translate for you?
Yeah, great question. I think that's something that I took with me from my dance career was how to stay motivated and disciplined and push myself. I think throughout ballet, I learned that, you're not always going to be told what to do or always um, helped, I guess. You have to sometimes be able to push yourself every day to be able to improve. And it's those little improvements that you make every day um, that make the big difference after a long period of time. So I made sure to take that with me throughout community college, throughout UC Berkeley, and throughout podiatry school, those same concepts of pushing myself a little bit every day and giving myself the chance to try my best before every performance or exam. I kind of treat it very similarly before a performance and before an exam mentally. So, and probably before surgery, like when I start doing those like by myself, but basically preparing myself the best that I can or knowing that I did the best that I can to prepare and then just seeing how it goes that day. So when it came to performing, you never know what's going to go on stage. Like your costume can rip, your point shoe can fall off, you can fall. So many things happen on stage, but knowing that I tried my best to prepare really helped me mentally to prepare to do that. And then I took that with me for exams. You never know exactly what to expect on an exam, but knowing that I did my best to try to review everything, study as hard as I can, and just knowing I did my best, whether that gives me an A or less, that's kind of out of my control at that point, knowing I did my best. And then same thing, once I start doing surgeries, that I prepared the best that I could. Things can go wrong on the day of something might not be there that you need, but managing that and learning a little bit from every experience that you get and growing as a person and as a dancer or as a surgeon that way is something that I'll bring with me throughout my whole life, I think.
Tremendous growth and life lessons that apply in so many different arenas.
Definitely, definitely. Yeah, I've seen dancers become, successful in all different types of careers afterwards. That dance career is not very long, so a lot of people do go into different careers. So I've seen dancers become super successful lawyers, real estate, pilots, like you can really do anything just from that same mental discipline that you get from an athletic sport or, performing art like ballet.
Let me ask one more question while we're
Yeah.
on this path. I'm super curious about top athletes
Yeah.
and there's an equation, so much of it is physical and so much is mental,
Yeah.
and how that changes over time as you become more proficient. Can you talk about that a little bit? Is that an issue in ballet?
Oh yeah, actually for me, I started where before performances, I was never nervous at the very beginning, but as I started doing bigger competitions, bigger performances in front of more people, and there was more expectation for me, especially after the documentary came out and after my mom had uploaded my YouTube videos. I think like the pressure increased a lot. I think at this point, like my YouTube videos have like 30 million views, but at that point, probably like 10, 20 million. But I had that pressure on me, so I had to really prove myself. So I guess the more experienced I got, I actually became more nervous before performances. But I used that adrenaline and those nerves to actually help me perform better. And I realized that, I don't know, when I had that adrenaline, I performed much better. So I used that to my advantage. However, it was not a great feeling to feel nervous before performances. But yeah, that's something that changed for me as I became like and more professional as well. And yeah, you just learn a little bit from every performance, from every mistake, anything that happens, you just learn a little bit throughout the performances, throughout the weeks and the years, and you just are ready to expect anything by the end.
I keep thinking of the word processes. It sounds like you engaged in processes that enabled you to be successful that continued on through your career.
Yeah, hopefully.
That's great. Thanks, Joe. I mean, this
Yeah.
this performance anxiety and delivering under pressure, and it's
Yeah.
one thing to deliver when nobody has any expectations and nobody knows you, and it's another thing once, like you said, people were knowing you and expecting great things, and it's a different kind of game. Not a game, you know what I
Sure.
mean?
Yeah, for sure, for
Mental
sure.
game, different
Mentally.
mental
Yeah.
game. Yeah. And
Absolutely.
and if it's okay, I'd love to kind of not totally dive into that, but maybe touch on it a little bit because we're
Mhm.
we're seeing this in a lot of different arenas. Certainly sports careers, we can absolutely see so much sports psychology. I'm not
Yeah.
sure if they have psychologists in dance to help um, learn how to navigate those different experiences. But
Yeah.
some of the best talks that I have heard at certain CME courses have
Yeah.
been on sports psychology and this idea that surgeons are very much like professional athletes. And in
Yeah.
this case, I'm going to consider dance in the same realm as professional athlete in the sense that it requires, to your point, Jeff, the mental acuity along with the physical. But I
Yeah.
think the really, and having been an artist myself, not ballet,
Mm.
not dance, but I think the thing that's, and actually, I'm going to save my opinion because I want to get yours. And we'll start with that and then I'll go back to where I was going. There's so many things I want to talk to you about. What do you think is the difference between a professional athlete and a professional dancer or
Mm.
any professional artist compared
Yeah.
to sport?
Yeah. Well, one big thing is you have to really act a lot with like a lot of professional art forms, whether it's like acting or musical theater, ballet, opera, like those performing arts. You have to really tell a story almost while you're doing whatever that is. And that's quite different from a lot of professional sports where you're able to like grunt, you're able to like, you don't really have to show too many artistic expressions with your
Yeah.
facial muscles. I would say they're both incredibly difficult. I respect people from all areas of sport and um yeah, but I think that's the biggest thing, at least with the difference between performing arts and professional sports is telling that, being able to tell that story and express that emotion. I'm sure there are definitely times when in professional sports where you do act a little bit, for sure. But I think that was one of the hardest parts of ballet is making it look effortless.
Yeah.
Like in professional sports, you can show that you're making an effort. In ballet, what's the hardest thing, which is what takes decades even, is to make something that hard look effortless. That's the hardest thing. So that's the biggest difference for me.
I could definitely appreciate that, especially with something like ballet specifically, where you're having to do a physically demanding task, but
Mhm.
look effortless and light as the wind. And just, I could very much appreciate that. I think there's so much more vulnerability in art than there is in like athletics. Not to
Yeah.
say that you don't have, that there isn't opportunities for vulnerability, but, and I'll only speak from my own experience, but I was above average in art
Hmm.
and I couldn't get better because I wasn't willing to be totally vulnerable and just put my full everything into it because I was really afraid of what if they don't like it? What if people and I think you have to be willing to do that. And it's just a little bit different. And it's not a passion, it's not a love. And I don't know how to explain it other than the beauty of the arts.
Mm.
And so when you've gone through some of your transitions, as you've looked at this amazing opportunity and career that you've had in dance and you're transitioning into something like medicine, which is very much also an art.
Yeah, definitely.
What advice might you give anyone in the arts if they're considering, like, oh, I might want to be interested in medicine? Like, I never thought about medicine. Maybe I'm
Yeah,
not going to be good enough for it. What kind
yeah.
of advice might you give a arts student out there that's looking at medicine as an
Oh, that's such
opportunity?
a great question. I feel like I can talk to someone for hours about like things I would say. I was actually just mentoring someone earlier today who's kind of in that process right now. But I would say, you can do it. Like if you've been through something that is in the arts that takes, again, that discipline and that drive, you can definitely be successful in medicine. Again, it's quite intimidating to go into medicine because you're like, oh my God, it's only for smart people. Like maybe I haven't had the education all of these other people have had ever since they were young. Maybe I'm not smart enough. Like all of those thoughts come through your mind. Um, Maybe I haven't done enough STEM, all of that, but I have to like disagree and say that, you can take all your experiences that you've had in your other paths in life and bring that and make you such a richer, whether it's doctor or scientist or surgeon, just make you a richer, yeah, richer person and have a richer career in that and take those experiences with you. And it may help you even connect with your patients too a little bit better using those experiences and connecting to your patients in that way. So yeah, whether it's in the arts or if you were in something completely different before medicine, I think it's only adds adds to your career and adds to your life. So I think it's wonderful. So don't doubt yourself is what I would say.
Oh, I love that. And certainly through your career, you graduated with honors from Berkeley, California, University of California, Berkeley. You are a top student at Samuel Merritt, which I can attest to, having been a previous professor. And you're brilliant. And that's where it's so interesting to me as I've talked to people in the arts, where to your point, it's like, oh, I don't know if I would be good enough. But there are so many skills. It's just like you can learn anything. You've already got the legwork and the dedication and the systems and processes to be successful. You're just applying it to different content. And it's interesting to watch various fields and people to be wildly successful. So
Yeah,
just some interesting life
absolutely.
notes.
Yeah, I think that was one of my insecurities growing up was that I wasn't because of being homeschooled as well.
Yeah.
I was like, wow, I definitely and I have a family that's very, very smart. And I'm like, I'm not smart enough. Like I wasn't even confident even in like social settings. I was like, what if I look stupid? All of that. But I think again that discipline that you mentioned is you can really put your mind to something and go for it and learn. And life is just a learning process. So if you're open to that, I think you can really do whatever you want to do. Yeah.
That's a really nice little segue. But first, I'm going to have, as we talk about lifelong learning,
Mhm.
Jeff, I'd love to hear from our sponsor about lifelong learning, our
Yeah, let's do a
partners.
shout out to Baco
Yeah.
Diagnostics. We all know that early detection is the most important determination in improving patient outcomes. Baco Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Baco Diagnostics, helping podiatric physicians keep America on its feet. Uh, Joe and I love to give shout outs to Baco because we've experienced what they bring to our profession at all levels, whether it's for our students, whether it's for residents, whether it's for even us as practitioners. They truly, truly put podiatric medicine on the front burner and give back every day to our profession. So it's just an honor and a privilege to have them as a sponsor and get to talk about them all the time.
And I'd love to transition a little bit because I don't want to not talk about your podiatric career as well, because you're in your fourth year now. You and I got to meet in your second year, maybe a little bit in your first year, but mostly in your second year. You've had the opportunity to do research. Tell us
Mhm.
a little bit about your experience as a podiatric medical student.
Yeah, so yeah, like you mentioned, I'm now in my fourth year. It's been great. I've enjoyed my time. So my first year was mostly online because of COVID at the time, but we were doing our anatomy labs in person, and that was so fun. I loved anatomy lab. And then second year got to be a little bit more in person, but still a lot of online classes. And then I think third year was for me where it started to get really fun because we got to really start seeing patients and working them up. And third year was also the year I got to be in the OR for the very first time. It was October of my third year where I stepped into the OR and I was like, oh my God, it's like the movies. It's so cool in here. And I learned how to be, try to work in a sterile manner and I've loved it ever since. And yeah, I started really loving to work with patients, I think, the most, especially in my third year, and trying to connect with my patients while also helping them out. And fourth year has been so fun too because I've got to travel and see how podiatry is in different parts of the country. So I got to go to the East Coast to a few programs and then West Coast here in California along the coast to a few programs here and seeing how podiatry is in different parts of the country was really fun. And I hope to take that with me as well in residency. And yeah, I've met so many amazing, great people throughout the way. And I feel like podiatry in a way is like a small world. Like we all know each other and it's great in that way. So yeah, I've had a blast in podiatry school for sure. I'm gonna miss it. Like I'm honestly or I feel like I already miss podiatry school, even though I haven't finished yet. But I know as a resident, your responsibilities grow so much, so quickly. So I'm definitely savoring the time now where I don't have too many responsibilities yet.
Yeah, but 5 months. I think you have
Yeah.
5 months left, and it'll be the same in residency when it's like the end of your third year. It feels like residency takes forever, and then that last like 5, 6 months, you're like, wait, 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 not yet. I'm having so much fun. So,
Yeah.
um, in terms of some of the, so you've done research, looking at, and I'm really interested in this one. I'm a
Mhm.
little biased, but looking at the methodology for removing plaster casting for congenital talipes equinovarus. Can you talk a little bit about some of the opportunities you had and what sparked your interest in that particular topic?
Yeah, so I actually was interested first when I met Dr. Mitzi Williams, who was at Kaiser Oakland. Now she's at the Paley Institute in Florida. But seeing her work with her patients was so eye-opening and so interesting. And then I was working with one of our professors at our school, Samuel Merritt, and he was looking into like using shears versus the oscillating saw to remove the plaster casts and kind of the side effects of that for the patients. But I after looking at the literature and the research that's out there, it's very rare to cause any injury to an infant from the oscillating saw, even though it sounds scary. And there's ways to manage the anxiety that a patient and the parents can get from that. But what I found in the research is there's it's so rare to get an injury from that, and it's so much quicker than soaking the infant in a bathtub and using shears or something to try to get it off. So basically, that's kind of what I found, and that was kind of a fun project to be on and work on. So yeah, a little bit with that.
What are your thoughts, Jeff?
I think that's great research. And for many years, we've taken off casts with saws, and even practitioners don't realize that it's an oscillating saw sometimes. If you bring a cast saw into the operating room, some people think it's the same as a bandsaw in your garage. So a little education goes a long way too.
Yeah.
That's a great topic, though. How'd you come up with that topic?
It was proposed to me by that professor.
Oh, good.
And yeah, it was something I was interested in just because of the work I saw with Dr. Williams. And yeah, it just sounded interesting to me. And I got to kind of work with some of those pediatric foot models and practice my wrapping dressing skills on those. So that was really cool using the casting techniques. So we didn't include that part in the paper, but having that experience was fun for sure.
And will certainly go a long way for you because again, anytime that you have repetitive opportunities to practice something,
Yeah.
it will go a long way. So,
Yeah.
what are the things that you're the most excited about? Obviously, graduation is coming up. What are some
Yeah.
of the things that you're most excited about?
Oh, in the next year? I
Yeah,
have so many
sure.
things. Well, I'm excited for interviews, honestly, being able
Yeah.
to see, it's like going to be a huge reunion for all the residents I met, some of the attendings, and some of the co-externs I got to be with throughout these last few months. So I'm honestly like excited to see them again and reunite with a lot of my classmates as well, who I haven't seen for in months. And then right after that, I'm actually traveling to New Zealand to teach ballet, to teach some workshops. So I'm really excited to go to New Zealand. This will be my second time teaching there. And after that, yeah, kind of finishing up some of my last rotations at school, probably traveling to see my grandma in Japan later in the spring. So excited to see my grandma because I haven't seen her in 10 years.
Oh, wow.
Um, and the residency, I'm so excited to know where I'm gonna go.
Match
And
day. Yep.
match day, yeah, super excited for that. I think it'll feel so good once I know where I'm going so I can just start planning my life. And yeah, looking forwards to that for sure. And looking forwards to earning money finally.
It's nothing better than the day that you realize that you're not paying anymore. Well, if you take out student loans, I'm not paying to be here anymore. There's actually an opportunity for me to put some of this away.
Yeah.
So, as you have, go ahead, Jeff.
Oh, I'm sorry. Miko, I was
No.
going to ask you a little piece of advice. Our students start clerkships or externships as soon as March, just a couple months away. And Joe and I are already getting emails. Oh my gosh, it's coming. And you told us a lot, but we're still nervous. Could you give a piece of advice or two about not picking them? We've already picked them,
Yeah.
but when you're doing your clerkships and you get
Yeah.
into the grind of clerkships, do you mind
Yeah.
just sharing your experience and giving some advice to students that are soon to embark on that same journey?
Sure. I mean, it can be difficult because sometimes you don't know what to expect, but I think be, personable and try to get to know the people in the program personally as well. I think it's important to not only just see what they're doing academically and surgically, but see how they are as people and how they are to work with. So that's something to do and just try to be proactive and helpful. But read the room. Sometimes, that's super important is to know when to jump into something versus stay back and be out of the way, which can be difficult as a student. You want to be always helpful, but sometimes you're in the way more than you are being helpful. So trying your best to manage that can be sometimes difficult, but you'll learn along the way. Of course, keep, reviewing Crozier, Prism, all of that can be helpful. And and yeah, enjoy the cities that you're into on the weekends. I think some of my best memories are, hanging out with the residents and exploring the city I was in and see if you can see yourself living there and being at that program. Um, yeah, that's kind of some of the things I would say. And stay in touch with a couple people from school, some of your friends throughout it. It's nice to be able to talk to them and yeah, just see how they're doing. And sometimes you need a little bit of yeah, you need to vent to someone sometimes. So having those people are really important, I think. So stay close to a couple people.
Great advice. Thank you.
Yeah.
Yeah, that was exactly what I was going to ask too, Jeff. After
Oh, geez,
you've had
okay.
all these different experiences across the country, you've already done the advice, so we'll piggy to the next thing. Did you have any experiences? This is one I've gotten recently that I thought was an interesting question, where
Mhm.
you've had to navigate awkwardness. So I'll give you a couple examples. You have a co-extern, and maybe these didn't happen to you, but you have a co-extern who's constantly trying to one up you, right? They're just almost to the point where it's inflammatory, but like just awkward enough. Or another one, um, the chief resident or senior resident keeps talking to you in the middle of a case when you're trying to pay attention, trying to focus, and the attending is there. How do you
Mm.
navigate the awkwardness that happens during externships or
Yeah.
advice in how to navigate that awkwardness?
Yeah, it can, I mean that those things can definitely happen. Thankfully, those specific cases haven't happened to me, but those awkward cases can happen. And again, I mean having, a co-extern that you want to work well with, but if they keep one-upping you, that can start getting frustrating. Um, I think, standing your ground and trying to still prove yourself as best as you can to the residents and attendings while staying respectful. Like you don't want to have any discourse with anybody. It doesn't look good for you or them or for anybody in general. So staying respectful through all of it while still trying to show yourself off, I think is important. I think there's, space for everybody in this career, especially in like with residencies, maybe for the more competitive ones, you have to show yourself off a bit, but there's space for everybody in this field. And again, the podiatry world is so small that you don't want to burn any bridges early on. You want to try to, stay cool with everybody. So I think, yeah, trying to, if it's with co-externs, try to be respectful, but show yourself off as best as you can. And if it's a resident, if it was a chief resident that was talking to me about, if it's social or academic questions, I would still try to interact. I would still answer their questions, to be honest. I'm sure I would see that case again, and I could still be paying attention while listening and responding. So I would, I would be responding probably if that was me, and still paying attention to what's going on, but responding to the questions. I don't want to be rude and not be responding. So, but at the end of the day, trying to maintain good relationships as best as you can, I think is important in our field, while also, standing up for yourself here and there if you need. But yeah, it's those soft skills that are definitely important for sure.
Absolute soft skills. That's you nailed it, right? The maintaining that professionalism. And I think this also, your dance career has given you this grace. Like even just now, you handling that question, like just fantastic, Miko. And I'm just so excited to see where you end up next year and where your career takes you. And we really thank you for coming and taking the time out of your very busy schedule with being a student and traveling and doing all the things that you do to come talk with our audience and share your experiences.
Thank you, Dr. Richey. Thank you, Dr. Jensen. Again, I'm just super honored to be on this podcast again. I'm so grateful, and I use that cup all the time. So thanks so much for the cup.
We're going to send you another one.
Oh, thanks.
And I think the first one you got might just have my name on it. This one has mine and Dr. Richey's name on it.
Oh, perfect. Perfect. Yeah, I think the one I have just has your name.
You have a limited edition. So we're starting to like rank the cups that you have the limited edition. Yeah.
Oh, you do have a limited edition.
Yeah.
Miko, I echo everything Dr. Richey had to say. Thank you so much for joining us. You're a shining example of what podiatric medicine can be to anybody who's looking at going into the world of medicine who maybe hasn't been just focused on it since they were young. And the non-traditional student is very, very common now
and very successful.
And wildly successful. Yeah. I was going to say, that the artistic side of your brain that enabled you to compete and do ballet will serve you well in research going forward, because it just gives, you can think of ideas and things are one way, but they could be another. So I too look forward to following your career.
Oh, thank you so much, Dr. Jensen. Thank you. I appreciate it a lot.
Well, to all of our listeners out there, if you're listening on Spotify or Apple Podcast, we'd love it if you put a couple comments into the app, if you will. But always, we'd look for 5-star ratings. But also, if you're watching on YouTube, by all means, become a subscriber. And thank you again, Miko. And until we meet next week, cheers, everybody.